Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. So I hope everyone is having a great January, great start to your 2024 year. I know I am. It's actually been pretty nice here in California. We actually are looking at some rain today, but we could use the rain, so we're good. It was funny. I was talking to some colleagues recently on a big office call over Zoom, and everyone was freezing because you're in somewhat kind of snow or, below zero temperatures. And I'm like, me too. I have my heater on and it's 48 in California and sunny in there. I think they might have wanted to hang up on me. So I apologize for that, but I'm a Cali girl. You guys know that. And so we get cold here when it's not at least 60, but it's nice to have some good weather as far as getting some rain in here. And then hopefully the rest of the month will be manageable for all of you. So hopefully nobody is too cold. But you probably have heard, my Steelers are out of it. So I was having a moment last week, but with our third string quarterback, what are we going to do? So what are we going to talk about today? Well, I really want to revisit the eVisits or the digital encounters, and I want you to understand when you can use them, how you should use them, and if it's appropriate to use them, because I think it's actually a missed revenue opportunity for many practices. But first, the Codecast podcast is also brought to you today by the Select Coder. Get all of the decision-making information you need to code in a single online resource. Select Coder offers you the comprehensive coding guidance required to code accurate claims the first time. Try Select Coder for free. Sign up at decisionhealth.com/SC free trial. So I hope you try it. I've been working with it, and it's actually a pretty good product. I like it. So when we talk about the digital exams or the eVisits, if you will, what we're talking about are the online. They're over the E&M codes, so they're in that section, and the payers pay for it. And remember, this isn't about telehealth. It is a communication-based technology service, but that's the acronym CBTS. It's not tied to the former public health emergency. It's not tied to the waiver extension or anything like that. These were opened up for payment in 2020, so it seemed like they were tied to that, but they weren't. What this is that CPT developed these services, and it's codes 99421 to 99423, and they're for physicians, physician assistants, advanced practice nurses performing brief online services via secure platforms. So it's for established patients that have patient portals. So if you don't have patient portals set up for your patients where they can log in, I know I have one with my physician. It's called My Healthy Connection. And so then I log in, it's password protected. There's even a second safeguard to get in where they ask me a personal question, and then I can get in. And it's messages. So I can get information on my billing, on my prescription refills, whatever I need. And then if I have a question for either my provider or my nutritionist or anything like that, I can actually send it over via the portal. And what I really like about it is that the practitioners that I engage with, they get back to me within 24 hours. It's nice. So hopefully anybody that does have the opportunity to have that access does, because then you don't have to keep calling the office, hoping for a phone call back, or thinking that you have to make another in-person appointment or even a telehealth appointment just to get a question answered. Now, there are some rules when it comes to these services. First of all, just realize that these, again, are not considered telehealth services. They're considered CBTS, communication-based technology. And so you don't have to use the place of service 02 or a modifier 95 or anything like that. So it would still be place of service 11 because it's coming from the office. So it is a office interactive service. And there are also codes for clinicians who do not have E&M within the scope of their practice, so 98970 to 98972. But remember, those clinicians would be like PT, OT, dietitians for certain diagnoses. So for example, when I talk to my dietitian/nutritionist, I was diagnosed with diabetes last year. Luckily, I'm now managed by medication, and I'm back to where I need to be with my A1C, so I'm pretty happy about that. But I'm able to ask questions, and if there's a cumulative time threshold met, then she would be able to, under the supervision of the physician, be able to send that out because I have the correct diagnosis. But that's not somebody who could bill E&M, for example. And then the 99421 to 423, if I have questions from my actual physician. For example, there was one that came up last year. They put me on a certain hypertension medication. Again, I just had slightly elevated labs and testing that looked like it was there. I'm medication now. I'm completely controlled. But about 10 days later, and then into the next month or two, I noticed that there was a dry cough with one of the medications. And I won't say what it was because I don't want to say anything against a medication. And I just said, I don't know if you've known this, but this is weird. I have this dry cough that won't go away. And in my business, when I'm speaking all the time, that's a problem. And so between podcasts and webinars and, meetings, that would be a problem. And then I noticed my husband was on the same medication for his blood pressure control, and he had that. And my sister-in-law said, yeah, I'm not on that anymore because of the cough. And I'm like, oh, there's something going on here. And so when I was able to send that over to my physician, he's like, yeah, let me change that for you. And had a conversation back and forth. And I saw kind of a great thing that Betsy Nicoletti put on her Coding and Tell about these services. She likes to call them message, manage, message. And I like that because you're sending it's patient initiated. So you're sending something through your portal. Then the managing clinician, which is either the physician or again, the nurse practitioner, PA, or a clinician that is able in their scope of practice to give information, and then message again. They have to message it back. And it's a cumulative service over a 7-day period. And it's also a time-based code. And also remember that licensed professional counselors are potentially able to use these services as well. But make sure you look at the information. I know I gave it on my last Medicare webinar update in the fourth quarter, and I'm going to reiterate it again in the first quarter Medicare update that's coming up, that if you're using any kind of licensed professional counselors, make sure you know what is included in their license. They have to have a master's degree or a PhD, and they have to have certain hours of clinical time. So don't just have somebody that comes in and says, oh, I'm a counselor, I can do that. That's not necessarily true. But the 99421 is the 5 to 10 minutes, and it says online digital evaluation and management service for an established patient, up to 7 days cumulative time during the 7 days. And 99422 is 11 to 20 minutes, and 99423 is 21 or more minutes. And so when these services are performed through the HIPAA compliant secure platform, then you can then this can be billed. Now they're not to be used for non-evaluative functions such as test results or appointment scheduling or any communication that doesn't include evaluation and management. So you have to actually manage the patient and understand that that's why it's established, that you are following them for a certain diagnosis, for a certain treatment plan. And now these patients need some kind of initiated communication, and they may not be used for work done by clinical staff or clinicians who can't bill E&M services in the scope of practice. So be careful with that. They're messaging codes, not telephone, video, or in-person visits. So it's something that would be done as a type of face-to-face, but now it's being done over digital means. And so CPT goes on to say, and let me just quote here, it says the 7-day period begins with the physician's or other qualified healthcare professional's initial personal review of the patient-generated inquiry. Physicians or other QHP cumulative service time includes review of the initial inquiry, review of the patient records or data pertinent to assessment of the patient's problem, and then personal physician or other QHP interaction with clinical staff focused on the patient's problem. So development and management plans, including physician or QHP generation if they need to change prescriptions like I mentioned, or they need to order a test and subsequent communication with that patient online based on what they have to do. But it begins with the patient-initiated portal message. There was something I saw, I think it was Cleveland Clinic, and it was on LinkedIn, and they said, we're now going to put these generic messages in patient portals, and whenever they log into their account, we're going to charge them $50. No, 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 no. So that was something I actually responded back to that post, and they ended up taking the post down, going, okay, yeah, we can't do that. So it's an interactive exchange. So there's back and forth messaging and of the practitioner and the patient. And that goes on for a 7-day period of time that you're accumulating that time frame. And so the practitioner, the physician or the nurse practitioner, reviews the communication in the medical record and then manages that problem. So you have to have that documented really well. If the patient is seen in person or via telehealth, within the 7 days of using those codes, then you can't report them. So if messaging also relates to an E&M service that occurred within the last 7 days, or is related to a problem which, the patient was seen within that last week, again, you don't report it. It's outside those, I call them the global days, because it's either a new problem. I mentioned the cough, and that was like a couple weeks later after my last visit. I thought it was weird because I didn't have a cold. I wasn't sick, but boy, it was like, I felt like I was choking, every couple of days. I'm like, what is that? And so it was a side effect from that particular, blood pressure medication. So it was changed. So those are the kinds of conversations that would go back and forth, with the provider. They're time-based codes. So you have to make sure you put exact time. Please tell the providers, do not put a range of time and say, oh, I spent between, 11 and 20 minutes. No, they need to say I spent, 8 minutes discussing patient-initiated contact based on, whatever the patient initiated and asked the question for, and then what the physician had to do to manage. And then that has to be well documented. And then other requirements. Do you need consent? Yes, that is required by Medicare. They actually put it in their MLN information when they first came out with these codes. The biggest thing, and they show emphasis on this, it has to be patient initiated through the portal. It has to be documented in medical record. Patient had to have, or if the patient had the E&M service, again, 7 days, it can't be used for communication to that problem. So let's say the patient was seen last week, and they said, hey, I have a question on one of the medications you gave me. And they called the office and they said, we'll go through the portal. And it was 3 days later. You can't code for that or can't report that. And so make sure you know that's that 7-day global. There's an understanding that within a week of a patient visit, that the physician, if there's any follow-up needed, that's included in that E&M service. And again, established patients. It's also not billed by surgeons in the global period. It also has to be provided via a HIPAA compliant platform. So your EMR, again, patient portal, and that has to be very clear. And clinical staff time cannot be included. So do not allow your medical assistants to run to your doctor and answer these questions. It has to come straight from the physician. They have to sit at the computer and, at the end of the day and say, okay, or at the beginning of the day and say, okay, let me see how many messages I got, and spend the time. They're getting paid for it. So spend the time actually, understanding it, reading it, acknowledging it, managing it, and then responding back to the patient. Also, don't double count time with any other specialty or separately reported services. So if you're also billing chronic care management for the same thing, or INR monitoring, which is pro times, or remote patient monitoring, any of that, that's not going to be appropriate. And then there is an editorial note in CPT regarding the 98970 to 98972. Again, that's for clinicians who do not have E&M services in their scope. That's why I mentioned the dietitian or the speech language pathologist or PT or OT. But you have to make sure that sometimes those particular practitioners have diagnoses related services. Like I mentioned, the diabetes, you have to make sure that that is part of the understanding that you can bill that. And the similar guidelines as far as the 7 days, the 5 to 10, 11 to 20, and 21 or more minutes is something that you want to make sure that you are understanding as far as the global. And then there's a couple of questions that always come up where somebody said, can a licensed professional counselor use the 99421 to 423 codes for management of a client-initiated issue, such as an email inquiry related to their therapy problems. And it actually says in the CPT book, it says these are for physicians and other qualified healthcare professionals, the 99421 to 423. And so licensed counselors do not have E&M services in the scope of their practice. Remember that. So it's only for someone who has E&M in their scope. So it can't be a pharmacist. It can't be anyone that can't bill out under their own licensure an E&M service. So be very careful with that, because I've seen people trying to bill for things that aren't under the scope of their practice, and this is definitely a problem. And I know sometimes CMS and CPT use the term physician to include our mid-level providers. And under E&M, yes, because we have incident too, but that doesn't work when we're dealing with dietitians, nutritionists, PT, OT, clinical social workers. Please make sure you don't make that mistake thinking that you can bill the 99421 to 423 for those types of clinicians that cannot report an E&M service. And again, I think I can even include, the marriage counselors know, the pharmacists know. So they don't have those kinds of medical decision-making options under their scope of practice. So it's really important for practices to do their due diligence when they're getting ready to bill for a service. I know it seems like one of the questions I'm getting lately is all about that new complexity code, the G2211, and make sure you Google it. If you are a member of my Coding Corner membership, I've already sent it out to you. But if you're not, then you can Google it and make sure you get that information, because Medicare put out some guidance on January 18th for it. And they basically first told us about what you shouldn't do, and now they're finally saying, well, if it's this, giving us a couple of examples of conditions, chronic services, chronic conditions, chronic diagnoses that would qualify. But just make sure you understand, if you're going to use that add-on code, what the situation is. And please, I know I have a potential client that's coming in, actually they are a client now, that wants to automate that code with every E&M, and that's wrong. Please don't do that. And so not every code is going to qualify. And if you get caught doing that, you're going to get in so much trouble. So please don't do that. Okay, everyone. Well, it is now raining where I am as I'm recording this, and it's raining pretty hard. So we've got football on. I'm going to go watch my football games, even though my team's not playing. Now I'm a Lions fan because I want them to take it all. So hopefully we'll see them with a championship, first time. And I think I don't know if they've ever won the Super Bowl, but I do know that they just finally won a playoff game the first time in like 30 years. So good for them. So make it a great day, everyone, a great rest of your week. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.